Welcome back. In the chapter of health programs in India, today's session we will be discussing about the Kala Azar Elimination Program. The National Vector-Borne Disease Control Program. It is an umbrella program which is implemented for the prevention and control of 6 vector-borne diseases. So, we see that the National Vector-Borne Disease Control Program, which is an umbrella program which broadly covers the 6 vector-borne diseases, namely malaria, filariasis, dengue, Japanese encephalitis, chikungunya, and Kala Azar. In the previous sessions, we have discussed about malaria and filariasis. Today's video, we will exclusively focus on Kala Azar Elimination Program. Beginning with, Kala Azar is found to be endemic in 33 districts of Bihar, 4 districts of Jharkhand, 11 districts of West Bengal, and 6 districts of Uttar Pradesh. Kala Azar is endemic in these areas. Endemic in the sense the cases are in the usual expected frequency. For example, if they were expecting 100 cases in that area, then in the next year also during that specific period of time or during that 1 year of period, they are getting 100 cases. So, in endemic in the sense they expected 100 cases and the outcome is also 100 cases in that area. So, it is an endemic. Okay. In epidemiology, we studied the definition of endemic, epidemic, and everything. So, the centrally sponsored program for control of Kala Azar was launched in 1990 to 1991. So, we see that a centrally sponsored program. Who is sponsoring this program? At the central government, the central level. Okay, the central government is sponsoring the program, and this program was launched in the year 1990 to 1991. This has brought down the incidence of the disease or the in number of cases from 77,102 in 1992 to about 7,277 in 2015. For now, the updated value, you remember that according to 2017, the cases from approximately 77k they have been brought down to 5,000 cases. Okay, 5,000 cases from 77,000 they have brought down to 5,000 cases by the year 2017. This was 77 cases was in the year 1992. Okay, the remaining values approximately I said, so 77,000, exactly 77,102 cases, and in 2017 we saw it was 5,000, right? 5,758 cases were observed. Okay, so this was the marked reduction in the incidence of the cases was seen after the implementation of the Kala Azar elimination program. What are the strategies? As I said earlier, every program, the strategies are very, very important from the exam point of view. Any program is asked, the first thing you have to and must and should write are the strategies. What are the strategies for Kala Azar? Enhanced case detection and complete treatment, including the introduction of RK39 rapid diagnostic kits. And also they give the oral drug which is miltefosine for the treatment of Kala Azar cases. So what did they do here? They rapidly detected the cases. Enhanced case detection. First thing, they detected the case. Once the case was detected, there was complete treatment of that case. Okay, once the disease was found out, and then they were giving the complete treatment. Once the disease is diagnosed, the detection of the cases or the diagnosis of the case, later the complete treatment was given. And also for detecting the cases, this rapid diagnostic kits, okay, for confirming the cases, we had RK39 diagnostic kit. And in the treatment part, they used to give this oral drug miltefosine for the treatment of the Kala Azar cases. Clear, guys? First thing is enhanced case detection, followed by the complete treatment, including there was introduction of these RK39 rapid diagnostic kits, and oral drugs like miltefosine was given for the treatment of Kala Azar cases. The next strategy, so this was our first point. Okay, the second point is interruption of transmission through vector control. So the vector needs to be controlled. For controlling this vector, we have DDT. Recently the DDT has been replaced with the synthetic pyrethroid for the purpose of eliminating the sandfly causing the Kala Azar. So why did they replace the DDT with pyrethroid? It is because the sandfly started being resistant to DDT. They found out that they detected that this sandfly or this insect is started to become resistant to DDT. So they replaced DDT with pyrethroid. Simple, guys. The second point, what did they do? Interrupt the transmission. They interrupted the transmission. Interruption of the transmission was done by controlling the vector. How can we control the vector? By DDT. Now the DDT has been replaced with pyrethroid because the insect started being resistant. Followed by the other strategies are communication for behavior impact and intersectorial convergence. So as we discussed earlier, communication for behavior impact or communication for behavior change, wherein we have this interpersonal communication with the community. We educate them, we teach them how to bring in this lifestyle changes to prevent the disease, and intersectorial convergence, converging with the other sectors of the community so that they can effectively eliminate the Kala Azar. Followed by capacity building, improving the skills, improving the knowledge of the resource person. And then monitoring, supervision and evaluation. We need to monitor, supervise and evaluate the program. Followed by the research guidelines on prevention and control of Kala Azar. We also had this research guidelines for the prevention and control of Kala Azar. Can you guys just brush it up? So let us try to recall all the strategies. Do we have any plain place? Okay, here. Yeah, let's do it here. So what are the strategies we saw? We are discussing or recalling the various strategies. The first point was case detection, enhanced case detection, followed by the treatment, complete treatment. It also included the rapid diagnostic kit, that is RK39 diagnostic kit, and the drug for the treatment drug was miltefosine. Okay, the drug was given. Fine. The second point was the interruption of the transmission. The first point is done. The second point, interruption of the transmission. Interruption of the transmission by controlling the vector with DDT. Now it has been replaced by pyrethroid. Next, we see that we also studied communication, behavior change, and also intersectorial convergence. Fourth was the capacity building. Fifth, monitoring, evaluation, and also we saw supervision. Then the last point was research guidelines for the prevention and control of the Kala Azar. It has been developed and it was circulated in the states. So this was all about the strategies. I hope it's clear. Let's see. Case detection, complete treatment, interruption of transmission through vector control. Then we saw communication for behavior change, capacity building, monitoring, supervision, evaluation, research guidelines. So this was about the strategies. Followed by active case search. The active case searches are carried out during a fortnight. It is designed as the Kala Azar fortnight. So during this Kala Azar fortnight, the active case searches. They perform this active case searches. Who are involved in searching the cases? Active case searches. Who are involved? These peripheral health workers. Who are these peripheral health workers? Anganwadi workers, Asha workers. These are all the peripheral health workers. They will be involved, and certain volunteers like the NGOs and other, barefoot doctors, all of the other volunteers are also engaged to make the door-to-door research. We visit door to door, visit each and every home, door to door doorsteps, and we research about the active cases and refer the confirmed case of Kala Azar to the treatment center for the definitive diagnosis and treatment. After finding out the active case, we will refer that case to the treatment center. We refer the case to the treatment center so that they can diagnose it, confirm the diagnosis, and give the complete treatment for eliminating the Kala Azar in that particular individual. So you remember, guys, if they ask you in your Viva voice what is active case search, you have to say that active case search is carried out especially during a fortnight. It is completely dedicated as the Kala Azar fortnight, during which these peripheral workers, certain volunteers, they will go door to door steps, and they will inquire about any active cases. Once they detect any active case, they will refer that case to the treatment center so that they can give a complete treatment and perform the definitive diagnosis, followed by the incentive amounts. So what is incentives? The extra amount, or when you work extra, you get paid, right? Apart from the working hours, incentives, those are the extra amount. So this incentives bonus is given of rupees 300 is given to this Asha worker for identifying the cases of Kala Azar. So we saw that, right? In active case search, these peripheral workers go door to doorstep. So when they go to door step and they get one case of Kala Azar, they get paid rupees 300, and rupees 100 is given for ensuring one round, and rupees 200 for ensuring two round. What rounds? Rounds of insecticide spraying. Okay. So for the insecticide spraying, they get rupees 200 for one round, rupees 100 for one round and 200 for two rounds. So 100 per round. Okay. Followed by the patient being treated in the hospital. Now the active case search was done, or the Asha worker referred a case. So the patient who is in the hospital will be given rupees 500 as a compensation for daily wages. So the person is not earning his daily bread. He is not going to the his job or work or whatever. So he will be paid rupees 500 as a compensation for the daily wages for the time he is spending in the hospital during the treatment of Kala Azar. So these things most of the people will not know in the rural areas. So as the medical profession, it is also our duty to bring in awareness regarding these schemes and help the needy. Rupees 2000 for PKDL, post Kala Azar. We have this lesions, right? Dermal leishmaniasis, wherein the skin lesions are found post Kala Azar. So rupees 2000 is given to these people for the to the treatment centers for definitive diagnosis and the treatment. So very important, they refer the cases, and we give rupees 2000 for those who are suffering with PKDL. This revised strategy of total eradication of Kala Azar was launched on 2nd September 2014. So this was launched in 2nd September 2014. Clear, guys? This was all about Kala Azar. I hope everything is clear. If you like the video, hit the like button and subscribe.